So I think that the purpose for our panel, our third panel, was that I think we all recognize the need to deliver evidence-based programs where children and families are. I think Mary Jane's talk this morning really captures that we have to get more and more innovative about being places where children and families are served. A few key points really struck me from all of the presentations. I think there is some appetite for family-focused prevention programs in emerging settings, especially because they're non-stigmatizing. And that's something we can really, I think, capitalize on going forward. There's also possibilities for cultural adaptations in those settings, and that's helpful for us to start to see and become more dedicated to. It's possible for these programs to not interrupt the flow of those systems, and that's of course key to their sustainability. There's still some questions about how to fund some of these programs beyond the research timeline, and that's, I think, something we're going to continue to struggle with. We've heard today about trying to design programs for the funding, and I think that's probably going to be helpful for these emerging settings. We also heard that there's still continuing issues about allocation of time. So that's another thing that we'll need to attend to in all of those settings. We've heard about workforce and training issues being critical, but we also heard that there were unique considerations for the different programs in terms of workforce and training, and that's going to be helpful for us to continue to focus on. There's opportunities for professional niches, but that will bring with it some tensions between professions about who owns it, so we should not ignore those. And we heard about there being lots of opportunities to capitalize on technology. Again, some unique considerations for different kinds of programs in terms of technology, and different unique considerations for different populations in terms of technology. I'll come back to that. So I have just a couple of thoughts about looking forward based on what we heard from the third panel. I think we still have a small window of opportunity, but we need to try to inform the Affordable Care Act about how to fund some of these prevention programs, as well as how to fund workforce and training for them. So I hope we don't give up on that. I don't think that the window has closed. We need to continue to educate the public and community opinion leaders about the importance of evidence-based practice, what you were talking about, David, as creating an appetite. I think we still have a long way to go, and I was struck that maybe in Norway there is more appetite than there is here, and that's a separate problem from the infrastructure to deliver it. We don't even have the appetite yet as widespread. In that regard, I think that we still have issues of nomenclature that we're going to need to address too that could cause some problems with public understanding, since we have evidence-based programs, evidence-based treatments, evidence-based interventions, and evidence-based practice. So, and different silos may define those differently, and that's only going to hurt our cause in terms of public understanding. And lastly, how do we reach the populations who need these the most? I think that's still it's still an open question. And then how do we mitigate against the risks, to draw on what Stephanie was talking about yesterday from an economic standpoint? How do we mitigate against the risks of increasing disparities with increasing use of technology?